Welcome back to another Bali COVID-19 update. This is August 15th, 2021. And a lot of stuff's going on. Let's start with the numbers. Some good news and some bad news in the numbers. The 7-day average for new positive cases in Bali took a jump up to 1,420, and that was because of yesterday's 1,900 plus, and today's number down from yesterday but still high. The 7-day average for deaths is remaining constant at 36 a day. Throughout Indonesia, the number of new cases 28,598. So we're down below 30, so that's good news. And 1,270 deaths, that's not good news. Total number of individuals tested for all of Indonesia was 126,400, with a 22.6 positivity rate. Still way too high, but down from before. And I'm going to talk about that in a minute. And the 7-day average positive rate peaked at 25.5% on August 2nd and is down to 21.8% now. So good news there. And how about vaccinations in Bali? First dose, 3,109,867, so 72% we're at now. And second dose, 1,362,286, and 31.6% of the population have second dose. Great. And yesterday, 76,221 doses were administered, so still going on with the vaccinations in Bali, and we have vaccines. So good. What about the Bali numbers? Not so good. New positive cases 1,795. Recoveries 1,642. Deaths 36. And current active cases 12,444. Out of the 1,795 new cases, all are Indonesians, none are foreigners. That's to be expected. 1,405 are local transmissions, 375 from domestic travelers, and 15 from international travelers. Okay, so we're still getting high numbers from people traveling around here. I wish everybody would just stay home for a while. Okay, and how about by regency? Denpasar 595, Badung 368, Tabanan 166, Gianyar 160, Bulang 141, Bangli 102, Karangasem 91, Jembrana 87, and Klungkung 78. So, numbers, good for Indonesia. The percentage is dropping, but we still got a long way to go. And for Bali, I don't know what's happening here. Our numbers are way up. Let's see what Monday and Tuesday bring. And so what about numbers? Interesting article here. Thousands of unrecorded deaths. Lapor COVID-19 urges data transparency. Lapor COVID-19, I've talked about this before, is an independent data initiative. And according to them, they found that over 19,000 COVID deaths reported by district city governments are not registered in the central government's records. So they are calling for data transparency, particularly on the number of deaths during self-isolation. According to the data that they've collected from 510 local governments, 124,790 people have died infected with COVID-19. But at the same time, they said the number of coronavirus deaths published by the central government is only 105,598. So where's the 19,192? That's what they want to know. According to Lapor COVID-19's data analyst, Pak Said, the 10 provinces with the biggest gaps in numbers are Central Java, with 9,662, West Java, Yogyakarta, Papua, West Kalimantan, North Sumatra, Central Kalimantan, East Java, Banten, and West Nusa Tenggara. And so there are discrepancies there. Additionally, He said that the casualty data published by the government does not include deaths of people with probable status. And this is in contrast with WHO's recommendation, the WHO's recommendation for governments to include probable cases in their COVID-19 casualty count. And according to Said, the data shows that there are at least 26,326 deaths of probable cases. And he said if these are included, we would find that the pandemic has taken the lives of 151,116 Indonesians. So with the good news on national level in terms of numbers, according to the task force, the National COVID Task Force, the peak is past. So Indonesia is past COVID peak task force. The task force said the number of active cases and hospital admissions has been in a steady decline since July 24th, when we hit the high of 574,135 active cases. According to Dewi Nur Aisha from the task force, this is IT and data center, she said that we passed the peak as we saw a 25.77% fall, our reduction by 60,902 active cases on August 8th. And so she sees these statistics as encouraging. However, she cautioned that the health crisis is definitely not over yet. There are still cases surging in certain provinces, including North Sumatra, West Sumatra, East Kalimantan, South Kalimantan, South Sulawesi, and Riau. And of course, Bali. We've still got numbers here. And despite the number of active cases declining, the number of deaths averaged 1,652 according to Dewi for last week. So that's not good. Is the peak past? Let's hope so. If the peak is passed nationally and we continue with the vaccinations, and what about the restrictions? Well, tomorrow is the end of the usual weekly extensions, and so we'll see what happens on Tuesday, Independence Day. What's the president going to say, or Pak Luhut, whoever is going to make the announcement on Monday night? We'll have to see. So on Wednesday's video, I was talking about Pak Luhut coming here, the coordinating minister for Maritime Affairs and Investment. He wanted to find out why Bali's numbers are so high despite all the vaccinations ongoing. And so he was here, and he was in Bali too, and I'll talk about that in a minute. What he had to say was, well, it was pretty straightforward. He gave the governor 1 week to improve handling of COVID-19 in Bali. So he said, I think that in the next week there should be improvements in handling of COVID-19 in Bali. I've informed the governor. Other areas can do it. Why can't it be done here, he said. He said that provincial government needed to work harder in order to suppress positive cases and improve the handling of COVID-19. And he said if in the next week it's not handled properly, we're going to lose the trust of tourists in Bali. I don't know that a week is going to make any difference. He added, if you don't handle COVID well, it means that friends of Bali don't take care of the trust of outsiders to come to Bali. Don't be angry why there are no tourists coming. If tourists want to come, we have to show that we are disciplined. And so he was coming down on both the governor and other authorities in Bali, as well as the people for not being disciplined enough. Pak Luhut highlighted 3 things that he said needs to be done in order to improve the situation here. So first, he said, patients need to carry out isolation in a centralized location in order to prevent family clusters. And as I mentioned the other day, a family friend tested positive. He was told at the Puskesmas, sorry, there's a waiting list, just go home. Okay, so there's a positive person, goes home, and you've got a family cluster. So it seems that we don't have enough quarantine facilities. The isolation facilities need to have enough medicine, enough food, enough doctors, enough exercise, a good place. Everything has to be compact. Otherwise, people will be afraid to go into isolation. Second, he said, that the Bali provincial government needs to ramp up testing and tracing because it is far below the standards at this point. And, well, that's true. He said that if the tracing and testing is going on, authorities, officers will be able to identify patients more quickly and direct them to hospitals or to quarantine facilities, and the numbers will start to go down. He said that there's no reason, with all these people vaccinated, that the numbers continue to stay up while numbers are going down nationally. And the third, and probably the most controversial of this, he said that religious ceremonies in Bali must be reduced or stopped, delayed, in order to reduce the rate of positive cases, because he said when you have religious events with 1,200 people, you get a new cluster. And so he said if at all possible, things need to be delayed, shortened, put under control so that there are not hundreds of people hanging around in one place, many of them unmasked from what's been reported on social media. But I don't have any first-hand knowledge of that. Pak Luhut said that if the implementation is done correctly, the positive cases will go down. He said the PPKM restrictions were not being carried out sufficiently in order to significantly reduce cases here. And he added, don't be angry if there's no tourists here, because you're not handling the situation right. If you handle the situation right, tourists will trust Bali and they will come back once it's open, but we need to show that we are disciplined. So it sounds like he was pretty blunt about the situation here. And in Bulaling, he said, where are the isolation, the centralized isolation facilities? Why are people being isolated at home? So after he left Bulaling, the Bulaling COVID-19 task force team moved quickly in evaluating self-isolated patients who could be transferred to a centralized isolation facility. So maybe his visit here is going to have some effects. I was doubtful the other day, but he seems to be playing hardball. Now, what is this? He's given the governor 7 days. What happens after 7 days if the numbers don't go down? I don't know. Numbers yesterday, as I mentioned, 1,900, over 1,900, a new record, 51 deaths. Numbers today, well, I'm talking about this on Saturday, and so the numbers today, tomorrow, are to come. Everybody knows the situation here is not very good. Our numbers have stayed pretty much stable until yesterday. With the 1,900, they shot way up. Where did that come from? I don't know. And the deaths, where did that come from? I don't know. Maybe they're people that they hadn't counted before and they put them in there. Not sure. Are there going to be any changes? We have the PPKM4 restrictions ending tomorrow, and Tuesday is the day that we're going to start again. That's also Independence Day. What's going to happen here? What's going to happen nationwide? What's going to happen in Bali? That's going to be interesting. Stay tuned for Wednesday's report. And what about the future? So, vaccine certificate required for foreign nationals in Jakarta malls. Okay, so this is not happening in Bali now, but my guess is it will eventually. So the chairperson of the Jakarta Shopping Center Management Association announced that foreign citizens, this was Thursday, are required to show a vaccination certificate as a pass to enter the malls. Now, are they enforcing this now? I don't know. The chairperson, Ellen Hidayat, said that these are standard operating procedures on how foreign nationals can enter malls. Foreign nationals who've received their vaccination shots outside of Indonesia are going to be required to show a digital certificate along with personal identification for confirmation in order to get into the malls. However, she noted that the vaccine certificates overseas aren't integrated yet with the COVID-19 tracing app Peduli Lindungi. And so she said the government is still formulating the mechanism for mall visitations. Currently, there are no regulation on what action will be taken against foreign citizens who cannot present vaccination certification. So if you're in Jakarta, let me know. Have you tried to go into a mall? Have you gotten in there? Has anybody asked to see a vaccination certificate? I don't know. And this is what I've said before. It looks like if you're going to come to Bali, well, you're going to have to be vaccinated twice anyway just to get in. So if you're not vaccinated, forget about Bali as a vacation place because it ain't going to happen. You have to have that to get in, and if you're here already and you're not vaccinated, you're going to be shut out of a lot of stuff. I've already mentioned in earlier ones about restaurants. You're going to need to show vaccination certification for restaurants and tourist things and government offices. So that's the future here. So if you're a anti-vaxxer, this is not going to be the place for you, unfortunately, or fortunately, depending on your point of view. Unfortunately, there are still people, both local and foreign, who try to use illegal ways to avoid vaccinations and or testing. This week, Bali authorities tightened up security at the border in response to fake rapid antigen test documents. So even though action has been taken against perpetrators of counterfeiting these fake tests, it continues to be done. There's many cases of counterfeiting rapid test certificates. The health coordinator at the Gilimanuk port, Yeti Sugiyarti, said that on arrival, all ferry passengers are required to go through screening, and this is in order to gain access to the island. And they make sure that the documents, the testing documents, are real by scanning the barcode. Sugiyarti admitted that some people have managed to get past the document screening in Java, at the port in Java in Banyuwangi, and so they show up in Gilimanuk and they've got these fake documents. Sugiyarti said people who allegedly show fake COVID-19 test documents at Gilimanuk port were required to get rapid tests by our officers to assure that they don't have COVID. We are aware that people are still selling fake documents near the port in Java. And Sugiyarti reminded people that are planning on coming to Bali to get their test at a licensed medical facility who will put barcodes on their documents so that authorities will be able to check them. And if they do not have a barcode on their documents, the officers at the Gilimanuk port are calling to check, calling the clinics where these documents have allegedly been issued. And tightening up the ports, both in Gilimanuk and in Padang Bai, has been something that everybody has called for here in order to keep people coming in who are positive. Okay, and more on people behaving badly. This isn't foreigners behaving badly, this is people behaving badly. These are locals. 2 karaoke businesses in Denpasar fined for secretly operating during the emergency partial lockdown. So 2 karaoke businesses were fined by authorities for violating emergency partial lockdown. It's not lockdown, partial restriction policies. The head of the Denpasar Civil Service Office said that 2 businesses were fined 1 million rupees for operating their business during the restriction period. Both were fined because karaoke places are not considered essential. I guess to some people they're considered essential, but not to the government. And apart from the fines, the authorities also decided to temporarily shut down until the partial lockdown ends. So they shut these places down until the partial lockdown ends. In addition, the managers of both of the karaoke places were required to sign documents which state that they won't reopen their business until the emergency restrictions are rescinded. And how did they find out about this? Social media. So there were multiple videos that went viral on social media showing them open and nobody wearing a mask and protocols not being carried out. The managers said that they felt that they had to open in order to provide services to their loyal customers. And so what did they do? They continued to operate by turning off the front lights to make it appear that they were closed. And they were warned that if they open again, they will risk having their businesses closed permanently. So, calls for more testing, more transparency in numbers, more vaccinations. But you can see, you can get vaccinated, like here, and our numbers just are not going down. And as I've said before, you get vaccinated, that doesn't mean you're not going to get sick. And here's an interesting article about the epidemiologist Larry Brilliant. And Larry Brilliant is an epidemiologist who is part of the World Health Organization's team that worked to eradicate smallpox. And according to him, the pandemic is not coming to an end soon, given that only a small portion of the world's population has been vaccinated. He called the coronavirus, the Delta variant of the coronavirus, maybe the most contagious virus ever. Brilliant said only 15% of the world's population has been vaccinated, and more than 100 countries have inoculated less than 5% of their people. He added, I think we're closer to the beginning than we are to the end of the pandemic, and that's not because the variant that we're looking at right now is going to last that long. Unless we vaccinate everyone in 200 plus countries, there will still be new variants. He predicted that the coronavirus will eventually become a forever virus like influenza. Brilliant also noted that because the Delta variant spread so quickly, he says it's likely to run out of candidates soon to infect. And so it came up, the numbers increased, and then they go down because everybody's been infected. And they're looking at that based on some models, what's happened in the UK and what's happened in India, where the spread went way up first as the Delta came in and then has dropped down. Okay, time for a wrap-up. Like the last video, some good news and some bad news. National numbers continuing to decline. Positivity rate is moving downward. That's the trend. You saw the graphs, the charts. So good news. In Bali, yeah, not so good news. And so what's the big news for the last few days? Pak Luhut, and along with the health minister and several other central government figures, coming to Bali to find out what's wrong, why Bali's numbers are not going down when they're going down nationally. And despite the fact that we've got such a high vaccination rate. Well, the 1 week that he's given the governor to clean things up, I don't know. Is something going to happen? I was just talking to my son, said down in Denpasar, he saw police and military going into shops and checking on people. So maybe the visit from the central government has lit a fire here under the local government. I don't know. That could be a good thing. What's the bad news? There's still people that are not taking this seriously. This is getting more and more lax in Bali in terms of the people here, both foreigners and locals. I was shopping yesterday, went into a building supply store. Everybody had a mask. Half of them had the mask down around their chin. What's going on? I don't know. I talked to my son, my daughter. They've said the same thing they've seen down in Denpasar. Some people have masks on, some people don't have masks on. And Pak Luhut said, we have to be disciplined here. So how does the government make people disciplined? You have a carrot and a stick. At this point, What are they going to use, the carrot or the stick? I don't know. Can we get the numbers down? Yeah, it's possible. Now, what about the long term? So I was talking about in the segment about Larry Brilliant, the epidemiologist, what he had to say, and there's a new study that's come out talking about the same thing. What's happening with the Delta variant? Where are we going in the future? But I'm not going to talk about that today because I'm trying to keep these short. Since I'm doing 2 a week, I'm trying to keep them around the 25-minute level. So I'm going to talk about that, a different perspective on Wednesday, and we'll see what that is. So what do we need? We need to keep vaccinating. We need to do the social distancing, not happening. We need to wear the mask, getting lax about that. If we want to open up, we've got to stick with it at this point. With the vaccinations rising like they are, we should be seeing numbers drop, and we're not seeing them drop here. So we're just going to have to wait and see what the next week brings. How's the government going to respond to what Pak Luhut said? I don't know. And are we going to extend the restrictions on Tuesday? My guess is yes. Is Bali going to open for B211s? My guess is no. Not now. And when's Bali going to open? As I say, every video, you have to have a crystal ball, and I don't have one. So that's it for today. Thanks for viewing. Stay safe, wear a mask, get vaccinated, follow the protocols, be a positive, not a negative here, and be kind to someone today. See you next time.